This next ECG exercise is number 8, and you'll find it on page 88. And boy, this is a nasty looking rhythm. Does not look good. So let's start with the heart rate. Now, the heart rate's approximately 40. Now, don't ask me where I got that 40 from, because, you know, if you calculate from here to here, that's probably closer to 50. From here to here is probably less than 40. If you take the 4 complexes, you know, we'll assume this is roughly a 6-second strip, multiply by 10, you get approximately 40. So there you go. Now, really, you need to see more of this ECG. You need to know more about this patient, and you need to check pulse, right? That's the gold standard. So heart rate, we'll say, is about 40. P waves are present and pretty consistent. The PR interval is approximately 24.24 seconds. So we know we have some sort of first-degree AV block going on there. So we've got that problem. The QRS is narrow. It's 0.12 second. The ratio is 1:1. The rhythm is irregular because we have this, you know, rhythm that's between here and here is irregular, and then we have this pause here. And so when you see some semblance of sinus rhythm here followed by a pause, if you recall, to be called a sinus arrest or sinus pause, there has to be at least 2 beats missing. And we can guesstimate here that there are at least 2 beats missing in here, and this next one falls out of sequence. But the reality is this rhythm is completely irregular. I mean, these 2 R waves are not equidistant with this one, of course, and there's this pause here. So it's really quite irregular. And if you recall, this is a sinus pause. You'll recall the cause of a sinus pause is 6 sinus syndrome. So when you have a diseased SA node, then the you know, SA node is not going to fire as it normally would, not regularly. So if we want to determine how long this pause is, because that's important, right? We count the seconds. So this is, we'll say 1, 2, 3, 4, 5. That's 1 second. 1, 2, 3, 4, 5. That's 2 seconds. 1, 2, 3, 4. There's 5. We'll say 3 seconds. So this is a 3-second pause. So what we have is a sinus bradycardia with a sinus arrest lasting approximately 3 seconds. Now oopsie, let me erase that. 3 seconds. Now we've also got this first-degree AV block, which is really neither here nor there, and it's not critical to report, but we'll document it. But what is important to ascertain with this kind of patient is the overall heart rate. That's important because this is a patient who may require pharmacological intervention or transcutaneous pacing if they're bradycardic and it's hemodynamically significant bradycardia. And number 2 is how often do these pauses occur? How long are the pauses? Because this one's about 3 seconds, but there may be pauses that are 5 seconds or 10 seconds or even 15 seconds. So we want to make that determination as we continuously monitor the patient. And what, first of all, how does the patient present clinically? Are they asymptomatic? Are they dizzy? Are they lightheaded? Are they having syncopal episodes with these pauses? Are they experiencing nausea, vomiting? And so how long are these pauses? How frequently do they occur? And what are the patient's signs and symptoms when they have these pauses? This is the kind of information we need to ascertain to determine what kind of treatment they're going to receive. And this is important information to report to either the triage nurse or the physician you're speaking to, or, you know, if you're a physician speaking to another physician, this information is critical.